This is something I don't get to talk about every day, but nevertheless still very important. So I'm actually at St. Luke's full time. So if you guys know the medical community, in the medical center, Floyd Curl near University Hospital, that's my hospital. I run the inpatient rehab unit there. And I do a bunch of consulting in the hospital. And if you guys ever have questions or concerns, that's my business card that I attached right there. We're going to go over some of the CDC recommendations. I know most people are familiar with the CDC nowadays because of COVID, but they also produce other good material for us to reference. Kind of the more dangerous things that can happen with summer and health would be heat-related illnesses. So we'll go through those. Of course, the basics with sunburns, sunscreen, avoiding dehydration, and then some brief things on pool safety and sunglasses. And as Sheila said, we'll stop every couple of slides if you guys have questions. So the CDC actually put out some tips for healthy summer living. If you go to their website and just type in CDC's healthy summer living, it actually brings you to this webpage like this. And it's kind of the obvious things. We'll start with that and then kind of get into each of those a little bit more in detail. But the first thing is exercise. Whether it's summer or not, they're still recommending exercise. And exercise can come in all different forms. They recommend 150 minutes of aerobic activity, meaning getting your heart rate up per week. Now, there's different guidelines out there, but I think that's a good rough estimate. Wearing sunscreen, I think all of us are pretty well aware of wearing sunscreen is important to do. And we'll go way more in depth than that. Including insect repellent. One of their tips is that they should not be applied together, meaning you put your sunscreen on first and then your bug repellent after, and you don't have to put bug spray on as much. It's a little bit more irritating to the skin, excuse me. Staying cool, so having fans, seeking shade, being hydrated, bringing those water bottles with you wherever you go. And then staying informed, meaning check the weather, bring out your smart app, look up the weather app on your iPhone or whatever app you use, the weather.com. Avoid the peak hours of the day where it may be most hot or extremely humid days like today. And then these are just the more of the basics, whether it's summer or not, but they're still recommending a healthy diet. Eat your fruits, eat your veggies. Your summer diet does not have to adjust compared to your winter diets. Maybe your hydration would a little bit. And when you stay hydrated with water. Now, we're all going to enjoy a different cool beverage every now and then, whether it's a soda or a beer if you're at a barbecue. But water is our best friend, and drinking lots of that during the summer is going to help everybody stay safe. And then more of their general guidelines is don't smoke, whether that's summer or not, don't smoke. And that wraps up the CDC guidelines, but we're going to go way more in depth now and start talking about just the sun in general and what its properties it has and why it can be harmful to us. So the sun produces two types of rays, more or less, or its energy. It comes in UVA and UVB. UVA is the rays that are causing aging. So if you want to avoid sunspots or wrinkles, you want to have that beautiful skin the rest of your life, if you can invent a way just to block UVA, then you would be very rich. UVB are more of the sunburning rays. So we step outside and we're outside for an hour in the sun, whether you're in the pool or not, and you end up with that nice red sunburn. That's because of the UVB properties of the sun. And if we just kind of looked at a schematic, UVA penetrates deeper. So maybe that makes a little bit more sense that it causes skin damage leading to aging and wrinkles. Whereas UVB turns you red like a lobster and is a little bit more superficial or just the surface of the skin. Now, before we go on, I'll pause for one after this slide. I'm not sure if any of you guys are Friends fans, but this is the famous episode where Ross goes and gets a tan at a tanning salon. It's a spray tan, and he can't figure out what way to turn, and he gets double sprayed. But when it comes to tanning, there's no safe way to tan. Now, I'm talking about tanning beds and from the sun. Spray tans, I'm not going to comment on, but from any type of UV radiation, whether it's in a tanning bed where you go in the device and it closes you in, or you're at the pool or at the beach, there's no safe way to do it. And it's because it's carcinogenic or could cause cancer. And we'll talk about skin cancers a little bit later, but there's no safe way to do it. It's fun, you know, sun is good for you. It'll help you with your vitamin D to an extent, but there's no such thing as safe tanning. All right, let's pause there. And Sheila, if anybody has questions, let me know, or if anything's popped up.
Does anyone have any? I have a question, and then we'll see if anybody else has a question. My question is you've talked about UVA and UVB. So when we buy a sunscreen, it always says, you know, helps with UVB, but does that also help with UVA?
It should be a broader spectrum. You should say UV protected or UVA and UVB. And if it's the spray, some of those are not FDA approved. Spray sunscreens, and we'll get into this a little bit later, are not FDA approved yet. So the lotion ones or stick ones, those ones have FDA approval and are monitored. Some of the sprays are not. So you want broad UV protection, and we'll get way more into sunscreen here in a little bit.
Okay, does anybody else have any questions right now? Okay, we'll move on.
Perfect. So speak of it, sunscreen. It's confusing. There's so many things on the market. Do you want lotion? Do you want spray? Do you want a stick? Do you want a gel? Do you want sunblock versus sunscreen? It's all very confusing, but I'm going to help you through this. Who needs it? The answer is everyone, because UV, A and B, can potentially injure our skin. We want to protect our skin as best as possible from those ultraviolet rays. And if we can protect ourselves from those, then we're going to protect ourselves potentially from skin cancer later on down the road. And anyone can get skin cancer, whether you're dark skin, fair skin, old or young, male or female. It puts you at risk. The more exposure, the more risky it gets. In fact, it's an estimated about 1 in 5 Americans can potentially develop a skin cancer in their lifetime. So skin cancer is actually the most prevalent type of cancer in the United States or worldwide. We often just don't include it into cancer statistics because it's way more prevalent than, say, breast cancer, colon cancer. So sometimes people will say, oh, well, breast cancer is the leading cause of cancer in females. It's actually not true, because skin cancer is often eliminated from that data pool because it's so common. But the good thing is it's extremely treatable, and prevention is the best thing we can do. So what types of sunscreens? And this is when we talk about sunscreen kind of versus sunblock. So there are chemical sunscreens and there's physical sunscreens. Chemical sunscreens act like a sponge. They absorb everything. They're easier to rub on. They normally leave you with less of a residue. They're more of that clear color appearance. Physical sunscreens or sunblocks classically are the ones that you see people pancaking on their nose and it leaves them white, or they have a white gloss across them. That's like a shield, and it actually deflects or kind of reflects the sun's rays. If you have sensitive skin, normally sunblock or the physical sunscreens are a little bit better for you. Just as a comparison side to side, the more sun yellow on the right side is representing sunscreen. The one on the left is more of the sunblock or physical sunscreen. So physical sunscreen is made out of materials, whereas the chemical sunscreens help you filter the light. Again, sunblocks do that. They block. Sunscreens or chemical sunscreens are more of the absorbing. The nice thing about sunscreens is they're a little bit lighter, less sticky, whereas the sunblocks or the physical sunscreens are denser, they're harder to blend, they leave a kind of a white residue on you sometimes. The good thing about the sunblocks or the physical sunscreens is you put them on, there's no wait time, you're good to go. However, the chemical sunscreens, as we kind of all remember, you have to spray them on, and it always says on the back of the label, or put them on, wait 20 minutes before you have sun exposure. Either way, both have to be reapplied. It's individualized to each sunscreen. They'll always have that recommendation on the back. In general, it's about every 2 hours. And again, if you have sensitive skin or rosacea, the sun blocks or the physical sunscreens may be a little bit more delicate for you. Now, SPF, every bottle of sunscreen has SPF. The best way I can describe SPF, well, first of all, it stands for the sun protection factor. And basically, SPF stands for what the dose of the sun's energy can do to you compared to when you're wearing or not wearing sunscreen. Let me try to explain it in a different way. It's a measure of how much solar energy is required to produce a sunburn on protected skin relative to the amount of solar energy required to produce sunburn on unprotected skin. The easiest way I think of it is it's the sun dose that day, and the dose can change. The sun is more powerful on different times of day. It's more powerful when it has the ability to reflect off of other things such as snow, or less powerful if you have a little bit of cloud coverage. Either way though, even with its clouds and overcast, it's still present, those UVA and UVB radiations, and can still cause a sunburn. I think it's important to know that there are certain times of day when the solar energy is more powerful. So I guess the following exposure may result in the same amount of solar energy. If you spend 60 minutes in the morning time compared to 15 minutes in the afternoon, call it 9 a.m. and 1 p.m., that roughly could equate to the same amount of exposure of solar energy. Now, what type of sunscreen? The American Dermatology Association came out and gave out the following recommendations. And these are the 3 biggest things I could recommend for you guys. Make sure it's broad spectrum. And this gets back to your question earlier. It protects against UVA and UVB. The right SPF is anything more than 30. It's always the great debate, right? There's people out there that has SPF 15, SPF 100. I think the right thing to do is just make sure you're above 30 and you're okay, and make sure you're reapplying. The best sunscreen is the one that you like, that has those factors, and that you're willing to put on again and again. Again, no sunscreen is one and done, all day you're good. You have to like your sunscreen and be willing to put it on again and again. And if you find one, keep to it, because that'll keep you protected. Sunscreens could be sold in combination with insect repellents, but the AAD, which is the Dermatology Association, does not want you to do that. They'd rather you buy regular sunscreen with those 3 criteria, put it on first, and then go ahead and do your repellent after that. And then again, current FDA regulations on testing and standardizations do not pertain to spray sunscreens at this point. I'm not saying spray sunscreens don't work. I'm just saying that they're not regulated by the FDA. Okay, and the last thing is use sunscreen every day you'll be outside. That's hard to do. I would say my wife is probably the perfect example of this. She puts sunscreen on before she leaves the house every day. I do not, so I'm a culprit of this. But if you're going to be outside and you want the right answer, that's what you would need to do. So let's pause there and see if there's any other questions.
Okay, so one question was, which do I put on first, the sunscreen or the repellent? You'd answer.
Sunscreen first. The reason is if you put on the repellent first, we don't think the sunscreen may be as effective and may not get onto your skin. So sunscreen first, repellent second. In general, sunscreens can be applied a little bit more frequently than bug spray. Bug spray or repellents can be a little bit irritable to the skin. That's why we don't need to do it as often. They tend to have a little bit more harsher chemicals, which you don't want on you as often throughout the day. So sunscreen first, repellent second.
Okay, and I have a question. So if we put the sunscreen on first, for insect repellent, I use plant-based. So would the oil from that, after I spray it on my sunscreen and then I reapply sunscreen, will that prevent the sunscreen from protecting my skin? Good
question. I don't know if I can give you 100% certainty that it will or won't, but I think the odds are that you're setting yourself up for success. So sunscreen first, repellent second. Does the repellent kind of counteract the sunscreen? Yeah, I mean, it would take a good study to tell me if it didn't, but I would put all my betting money in that you're going to be okay.
Any other questions from anyone? on?
Okay, let's move along.
Okay, we'll move on.
Now, sunburns, and this just cracks me up because I'm sure this is not the only gentleman that's had this type of sunburn now that COVID was occurring, and hopefully nobody gets those much longer with the vaccine out. How to treat a sunburn. Treat it as soon as possible. And the best thing to do is stop your UV exposure. So if you're getting red, time to get out. Seek your shade, get inside, put a hat on, put your shirt on, get out of the exposure as fast as possible. Things that may help with this, the pain and irritation that comes with a sunburn, are cool baths, because that's going to reduce the amount of heat on you. Moisturizers tend to help because sunburns cause you to be dry, and dry skin is angry, irritable skin. So moisturizers are good. Not petroleum though. Petroleum will trap the heat, and that is not something I want you to put on your skin. If it's really irritated and you're really red and very itchy, yes, topical hydrocortisone, which is an anti-inflammatory, is okay. Other things that you may want to try are aspirin or anti-inflammatories, specifically ibuprofen, because they can lead to some of that reduced swelling that comes with the sunburn, and that may ease the redness and ease your discomfort. When you have a sunburn, think about increasing your fluids. When you damage your skin, it takes extra volume, fluid, water to sense that area to help it heal. So you want to make sure you're staying plenty hydrated when you do have a sunburn. And then as a general recommendation, when you're at home, don't put on numbing agents, things like benzocaine or lidocaine, which are over the counter often, because those tend to be a little bit irritating for sunburns. Now I'll tell you, that's a recommendation for kind of home sunscreen management. I'll tell you, if someone does have a really, really bad sunburn that comes to the hospital and has to get admitted, I sometimes will put topical lidocaines or benzocaines on them because the pain is so severe. But at home, avoid those products. If you blister, you have a second-degree burn. And luckily, I've never had one of these, but I've had plenty of friends that have had these. This is a pretty gruesome burn that this person has. But if it's blistering, it's a second-degree burn, and those are going to hurt. Don't pop them. Just let them heal untouched. Don't mess with them. Don't play with the bulla or the blister. Let them pop on their own. It's okay. You don't have to do it for it. If it blisters and it covers a very, very large area, let's say an entire back and a shoulder, both your legs, and you start getting symptoms, a second-degree burn with symptoms such as fever or chills, that's when you need to go see a doctor. Call your primary care doctor, because then you're setting yourself up for more complications. Other just general skin tips: seek shade, wear your hats. If you have the option of sitting under a tree versus baking out in the middle of a field watching a family member soccer game, find that shaded area. Dress to protect yourself. So there are UV garments now out there that have a protection factor. Wear something long sleeve, cover your neck. Those are good tips to follow. When you're really near something reflective like sand, snow, or water, so imagining you're going to go ski, you're taking a vacation to Utah, and you're on the slopes there, you're going to be a little bit more at risk because that sun is so reflective off the snow. Get vitamin D safely. Yes, it helps to get a little bit of sunlight to help you keep your vitamin D levels up, but there's plenty of other ways to get it through supplementation. You don't need to get excessive amount of sun to keep your vitamin D levels safe. Again, avoid tanning beds that has the same UV types that can produce cancer. And then check your birthday suit, meaning check your skin at least once a year. And if you've never done it before or think it's awkward, I'm going to teach you how to do it. So use a mirror and look in the weird places too. Look in between your fingers, under your arms, in the creases, your palms, even look under your fingernails. You got to look at the soles of your feet because you can have moles in places that may be changing. You need to know your body better than any doctor needs to know your body, because you're the one that is going to be looking at things more often. And you're going to know that, hey, this mole or this area is changing. And when things change, that's when we need to know to go get help. If it's a hard place to look at, grab a mirror, grab a family member, get eyes on it. You've got to check your neck and your scalp because those are sun exposed areas as well. Again, you got to look everywhere, including your backside. And before we get to skin cancers, let's pause here and see if there's any other questions.
Does anyone have any questions? Okay.
Oh, actually, I do. You mentioned about wearing certain clothing to protect you against the sun rays. How do you do that without getting too warm? Because you really have to pick the type of material correctly, correct?
You're right. You're right. So unfortunately, in my experience, when I try to follow those recommendations and I wear long sleeve shirts, I do tend to get a little bit hotter. But there's a lot of good materials out there. So I just bought a sun shirt at Bass Pro Shop that has an SPF protection in it. And when I wear it to go floating or I'm at the pool, it's not too bad, especially when I get water on it. It's actually a little bit cooling. But you're right. For the most part, if you're putting on more clothing, you're going to tend to get a little bit hotter, maybe even sweat a little bit more. But it's the sacrifice you're making to kind of keep your skin safe.
Right. Yeah. As I'm saying, in the long run, you're more likely to get burned a lot faster than you are to go through heat stroke. Usually.
Exactly. Yep. I share the same struggle sometimes. So yeah, I hear you. Any other questions?
Okay, we'll move on.
Okay. So when it comes to skin cancer, basal cell and squamous cell are the ones that I would like to talk about the most because they're some of the most common types of skin cancer. But the good thing is they're very curable. Basal cell and squamous cell come from the top surface of the skin. So they were once normal cells that then kind of mutated, started doing their own thing and became a little bit different and then eventually turned cancerous. That's the best way I can explain what happens. And the things that cause those mutations, the biggest risk factor is sun exposure for them. The good thing, they're slow growing. So if you find them, we can treat them. Skin cancer appears in the body many different ways. So it can look like a mole is changing or a certain mole is looking different than other moles on your skin. It can have kind of a domed shape growth to it. Sometimes it'll start scaling when it never scaled before. Non-healing sores or sores that heal and then return, meaning, hey, this thing on my forearm, it was there for, I don't know, a few months. It kind of got better and now it's back. That's something to look into. And then anything that's under your fingernails that you see that potentially is new, growing, changing in colors, yes, you can get some skin cancers that grow under your nails as well. The best way that dermatologists tell you to kind of check and be curious is if something differs from the others, if something's changing, if something itches or bleeds, that's probably concerning enough to go see either your primary care doctor or your dermatologist. We're going to move away from skin cancer and we're going to go to pool safety. Just one quick slide. We're all going to be around pools this summer. We need to be safe. So first of all, I believe it is Texas law, unless it is law in most states now, you have to have a fence around your pool. And it's actually pretty strict. So there's guidelines on how tall it has to be, how much gapping you can have between the bottom and the start of the fence. Another safe thing to do is what we do, touch supervision. So if you're with a child in the pool or someone who doesn't know how to swim, you want to be in touching arm length, meaning you don't want to be on one side of the pool or up out of the pool. You want to be within touching arm length of them. If anybody drowns and comes up and they're not in good shape, no pulse, no breathing, you start CPR right away. That's the best thing you can do. Start CPR, start that emergency action plan, Hopefully there's someone around you where they can call 911, but you do not waste time. Time is the most important factor. If you can cut down on time between starting CPR and finding the patient or the person that's drowning, you may save their life. And then use approved flotation devices. And in fact, if nobody's using them, they're considered a risk factor for drowning because people can get caught in them. So just get them out of the pool if they're not using them. Sunglasses. So sunglasses, like sunscreens, can come in many different forms, with the lenses being, tinted, having UV protection or not, all different colors. What you're looking for is something on a sunglass, and normally it has a sticker like it says here that mentions UVA 400. Sorry, it's supposed to be UV 400, or UVA, UVB protection, or broad UV protection. But yes, you want to keep your eyeballs safe. The American Ophtho Society, so the people who are eye doctors that created guidelines on this, recommend that your sunglasses have broad spectrum UV protection. And the reason why is that your eyeballs can get sunburn. Now, we don't call sunburn of the eye, the proper name of it is photokeratitis, but it's essentially the same thing as what happens to your skin. You irritate your eyeball and it ends up being painful. It can present as red eyes. Sometimes people say they have a very gritty feeling, or as if there's sand trapped in their eyes. You have a sensitivity to light. Sometimes people excessively tear. And the bad thing is, say if you're outside a lot because of your occupation or one of your hobbies, wearing sunglasses may be protective from long-term health concerns like cataracts, different types of eye cancer, something we call surfer's eye, which kind of looks like a black spot on your iris, and then macular degeneration, and all those things you don't want later in life. So sunglasses are a good thing. Yes, if you're outside, just like sunscreen, probably a good idea to wear sunglasses also. Just make sure it's the right type. Before we get to dehydration, because we're switching topics a little bit there, any questions about that?
So when you get sunglasses, should you get bigger glasses?
Good question. So in general, you want something that fits pretty close and snug to your eyes, nothing that's excessively big where there's gaps where IV or where the UV radiation can get through. So yes, I want you to be stylish and looking good, but let's say you have really big stylish sunglasses that are off your nose and the light has the ability to still get to your eyes or your eyelids, that still could potentially cause problems for the skin on your eyelids, cause sunburn, cause complications. So you want it to kind of fit as snugly as possible, but I also want you to be stylish too. Other questions?
Actually, I have a pair of I guess attachable sunglasses that
Yeah.
usually go with glasses. So those, again, they may fit more of the stylish category because, like you said, they kind of still have the gaps from the glasses.
Yeah.
And I have another pair which they're more like what you're talking about, something more snug. So yeah, so that makes sense what you were saying about the difference between the two.
Yeah, and if they connect to your glasses, I'm willing to bet your glasses are probably, just because if you're helping your vision, fit you pretty good. So that sounds pretty good.
Yeah, and it's because the bigger ones fit over my glasses too. So I was gonna say real quick, is there like a certain rating for sunglasses?
I wish, right? So actually, I did some education for myself yesterday. I was perusing some different websites that sell sunglasses and seeing if you can actually see, gradings or not. To my knowledge, no, there's no specific grading. Now, sometimes they'll say protects up to, X% of UV. I think as long as it says broad UV, so UVA, UVB, or UV 400, you're okay.
Okay. Yeah, so this isn't just a matter of just don't look at the sun. It's the rays can still get you in an angle.
Correct. Yeah. Don't look at the sun anyway. But even if you're not looking at the sun, it can still be harmful. I mean, I think we've all have been there at least once in our life when we're out, at the Pearl or somewhere all day, and you don't have sunglasses, and you come back home and your eyes feel like they're on fire or they're very irritable.
Right.
Basically, you sunburn your eyeballs right there.
Okay.
Yep.
So
Like-
reflection from like windows or things like that, will that hurt your eyes as well?
Potentially could be, so windows are a funny thing. So I believe, and I had it in my slide earlier, so UVA can still pass through windows. UVB, we don't think passes through windows. So yes, if the, just like if you're at the sun, or sorry, at the beach when there's sand around, or on a mountain and there's snow, even the reflection, or even if you're inside and it's still bright, there's still some degree of UV that's gonna be bouncing off or coming through. Now the exposure may be less and you may not get a sunburn on your eyeballs or the photokeratitis. But I think you have to just use good judgment. If you feel like it's gonna be really bright and you're outdoors or indoors and it's prolonged time, there's nothing wrong with wearing sunglasses. If you know your house really well and you're near a window and you do this all the time, you read it in your little nook and you don't have problems with your eyes, you're probably fine.
Okay, so the magic number for sunglasses is 400.
Yep, exactly. Yeah. Now that's just a saying. There's no such thing as UV 300 or 200. It'll just say UV 400. You see that, you're good. UVA, UVB, you're good. Or broad spectrum UV, you're good.
Okay, are there any other questions? All right, we'll move on.
Let's talk about dehydration. Dehydration is just a fancy term for that you're losing fluid, whether you didn't drink enough to keep up with your losses or your losses are outpacing what you're taking in. You've got a net loss and you're dehydrated. And it comes in different forms. It just may be a little bit more risky during summertime because you tend to be sweating more. So whether it's sweat or diarrhea or vomiting, you're all losing fluid with that. And if you cannot replace what you are losing, then you're going to lead to a net loss, and that leads to dehydration. Now, dehydration itself, or the volume, is not super dangerous. What's dangerous is when you do become dehydrated, if you lose excessive amounts, now you're playing chemistry with your blood. And the sodium specifically can start to alter. And the electrolytes of your blood, specifically sodium, likes to fit in a nice little pocket. And if you become too dehydrated, that sodium or the electrolytes get out of whack, and that's when you can get into some problems. So some of the symptoms that may happen with dehydration are cramping, headaches, lightheadedness, sometimes fast heart rate, which is kind of making up for less fluid in the tank. The heart says, well, I got to pump faster to make up for it. And then I start getting concerned when there's confusion. Dehydration with confusion to me is an emergency, and you got to get that person to medical attention. Believe it or not, the color of your urine is a pretty good indicator of hydration. So just like your mom probably taught you, if it's dark, drink more. If it's light, you're in a good spot. Stay hydrated for your treatments. Just preventatively, drink throughout the day. Most people, and I'm excluding people who may have chronic problems with either their heart, their kidneys, or their liver, drink about 2 liters a day. And your body is really good at regulating itself. You don't necessarily have to feel like you're forcing yourself to drink water. Drink when you're thirsty. But in general, about 2 liters a day is what most people drink. And your body and your kidneys, who filter everything, does such a good job at regulating it. Is kind of the rule I tell people is the next day when you wake up, your body's done such a good job that you're within about 0.5% of what you were when you were hydrated the day before. No matter what you drink, your body's just that good at regulating itself. Okay. If you're planning on going outside, drink before. You don't have to pound it an hour before, but pace yourself. About 4 hours before exercise is generally what a lot of the sports athletes tend to do. Drinking sports beverages is okay. But many times if you just drink water and stick to your meals, you're going to get all your electrolytes placed as if you didn't need that sports drink. So don't feel like you have to. Things that make people most at risk are a couple of medical conditions. So one, people who have kidney disease, heart failure, or liver disease, because those organ systems have a lot to do with how much water is in the tank or in your system. and it's very easy to drink or become too overloaded or underloaded with fluid. So those are the three conditions I tell people that, maybe 2 liters doesn't apply to you. We got to individualize this a little bit more to yourself. If you're elderly, the tendency is that people don't realize they're starting to get dehydrated compared to someone who's a little bit younger. So their response time is a little bit less. So people who are elderly are a little bit more at risk. If you're sick or infected, your demands are higher, so you probably need a little bit more. So that puts you at risk. If you're going to be exposed to heat, whether it's exercise or you're outside, that's going to put you at risk. And then those who have maybe problems with cognitive impairment, where they're not aware that they need to drink more water, would be a risk factor. And then certainly certain medications, ones that are like diuretics that make you pee more and get rid of your volume, put you at risk. Let's stop there for dehydration before we get into some of these heat-related illnesses. Any of you guys have questions?
I have one. So if now they have this new thing out, it's little packets, hydration, and it's, you know, add the packet to water and you're getting 3 bottles of water. How is that?
Yeah. So
What?
yeah. So my response to that is that's very misleading. You can't make up volume by just putting something into the bottle. I would say the volume means more. But essentially what those packets are doing is they're mimicking a sports drink. They're increasing the salt, potassium, and chloride in that water. I would say if it makes you drink, then great, because sometimes people don't like the taste of water. I prefer just telling you to drink more water without it and get all your electrolytes through your normal diet. We're pretty salt heavy diet here in the United States, so we don't really need to be putting extra things into our fluids. But I think the caveat to that is if you're just not a drinker and you don't like drinking water because it doesn't taste good, if you need to put something in it, then so be it. Now, I'm not saying Diet Coke replaces water or coffee does, because coffee can be technically a little bit of a diuretic. But some of that, the things you put in your drink, that's very misleading if it says it replaces 3 bottles of water. You can't make up volume if it's the same size cup.
I was gonna say it contradicts physics and chemistry of it. But yeah, I was gonna say too. I'm sure you've heard of the. Someone told me years ago, one should drink half their body weight. Is there merit to that?
Say that one more time.
We should be drinking like up to half our body weight per day or per certain time period. Like so,
no,
if
I haven't heard that. So that
Where
seems
you drink a ½ ounce for each pound you weigh.
okay. Yeah, there are some rules of thumb that you can calculate how much you should take in a day based off your body weight. But if you drink half your body weight, I would not recommend that. That would be really excessive. And it seems like a little bit too much fluids to me.
Well, that makes me kind of question then, Brett, because I actually, about 8 years ago, I read on GQ that you drink more water, you can lose weight. And I literally drink 4 of those 2 liters a day. And I've been doing that for like 7 years and I haven't changed. And my urine is clear.
Yeah. So that sounds like you're very hydrated. So if you were to drink an excessive amount of water, your body weight would probably go up, not down, because you're putting more fuel in the tank, right? So if you were to let's say fill your car up to, I don't know, full tank, right? And we added another tank to fill that up even more, your car would weigh a little bit heavier. But again, your body is so good at regulating this that if say you overdrink, then you're going to pee more and you're going to pee it out.
And I read that it'll take away that urge to be as hungry. So that's why I started.
Gotcha.
And it works.
Gotcha.
Also too, I used to be able to run 7-8 miles a day. So that was part of it. A gallon was no problem.
Gotcha.
Now it's a bit of a challenge.
Yeah.
So is there any way you can drink too much water?
Yes. So it is possible. So I will tell you, sometimes people who have dysregulation of some of their hormones tend to overdrink because their brain is telling them to drink more than what their body needs to. And just like under drinking can get you problems with electrolytes, or dehydration can get you problems with your electrolytes, if you overdrink, the same thing can occur. It'll alter your body's chemistry, throw off your sodium content, and then therefore cause a lot of problems. So yes, fluid is there's the right amount to drink. In general, it's right around 2 liters. But yes, you can underdrink. Yes, you can overdrink. But for the most part, if you listen to your body and you don't have any of those chronic problems that I mentioned, heart failure, liver problems, or kidney problems, your body's gonna work for you rather than against you.
Okay, are there any other questions on hydration? Okay, we'll move on.
Okay, so probably the most important and most medical type of things I can include in this lecture are heat-related illnesses. And specifically, we're going to focus on heat stroke and heat exhaustion. But real quick, heat cramps occur when you are probably dehydrated, you've been exercising a lot, and your sodium content or your electrolytes get a little out of whack. One of the common symptoms is people start to get muscle spasms, cramps, or pain. You know, I think classically we see the marathon runner who's on mile 20, who then all of a sudden starts grabbing their hamstrings because they're cramping. This is a heat-related illness. It's related to you that either prolonged exposure to the heat or with dehydration. But I would say heat cramps is less severe than heat exhaustion, and heat exhaustion is less severe than heat stroke. So let's talk about heat exhaustion and heat stroke. These are the more serious things. So in general, heat exhaustion happens when your body just gets too hot. You've exposed it to too much sun, you've overworked, you've overdone it in the garden, you've ran too much. And if you don't treat heat exhaustion, it leads to heat stroke, which is emergency. Heat stroke happens, you're going to the ER. Heat exhaustion, if you're around the right people or you can get out of harm's way, probably can treat it at home. But heat stroke occurs when the internal temperature of your body stops cooling itself and it starts skyrocketing and you start getting high fevers. And that's when potentially some organ failure can happen. When you have heat stroke, it can lead to shock, brain problems, organ problems, and in extreme cases, yes, it can lead to death. As your temperature rises, your body produces sweat to stay cool. But on hot and humid days, the ability for that sweat to work for you and cool your body becomes much more difficult. And your body has a more difficult time to cool itself down. So that would be a risk factor. Other risk factors include just hot temperature and exercises, which are the main causes of heat stroke and heat exhaustion. So symptoms. If you're outside, it's hot, you've been exercising, and you start developing muscle cramps, heavy sweating, more than your normal amount, you start to look pale or cool. You start to have weakness or confusion, dizziness, headaches, nausea, vomiting, fast heartbeat. That's when you say, okay, I'm probably leading down doing too much. I'm on the borderline of having some heat exhaustion. I'm symptomatic now. Shut it down. Get out of harm's way. If you're able to take your temperature and it's extremely high, I'm talking 102, 103, 104, you stop sweating, you have problems breathing. And I'm not talking about, I just ran a mile and it's hard to breathe. I mean, I've been stopped exercising for a couple of minutes and I still can't catch my breath. That's reason then to say, oop, this may be heat stroke. I got to get some attention here. Change something here. Heat stroke can lead to seizures as well. So if someone's out in the middle of an exercise in the sun on the track, you guys are spending all day at Morgan's Wonderland or wherever it is, and someone's all of a sudden start seizing, yeah, that's an emergency. So treatment, get out of Dodge's way, get out of the heat, lie down and elevate your legs. That'll help give some blood flow back to the important organs like your heart. Remove those extra clothing. So if you're trying to be really smart and wear UV protection and you had long sleeves, long pants, that's when you would want to really just expose the skin so it can cool off. Put cool things all around you, in your groin, your armpit, behind your neck. Lots and lots of fluids, because at this point you're very dehydrated with water or a sports drink. And again, if any of those warning symptoms happen where the patient is just not breathing well, they're having seizures, they're having confusion or altered mental status, that's reason enough to call 911. You're in too deep at that point. All right. And that's that's the completion of the lecture. And as far as things that I want to talk about, and that's a picture of the Pearl. And if any of you guys go there, maybe run through the fountains and stay cool. But any other questions?
I have one. So can you get a heat stroke or heat exhaustion if you're drinking water?
Yes. Yep. Even if you're doing your best to stay cool, you're being preventative. Sometimes your body just can't keep up, especially if you're in a situation that your body hasn't been in or trained for. So let's say you are, for some reason, your friend asked you to go to the beach all day tomorrow and, I don't know, exercise, and you're not in shape and you haven't been out into the sun for a while. Even though you stay hydrated, it is possible. Absolutely. Now, I would say your risk factor is a little bit lower if you're hydrated, but it can absolutely still happen if you're hydrated.
Okay.
I have a
and would you-
question.
Oh, go ahead, Cindy.
Yes, what type of water did you mention earlier?
Was that for me or Sheila?
You.
Okay. I don't remember mentioning any specific water other than I'd say sports drinks are safe. You don't have to use them. As long as you can eat your regular diet and stick to water, you're fine. In regards to sport drinks, I would say maybe they're a little bit more recommended than water if you're exercising for a prolonged time. So let's say you're running more than 60 minutes, you're exercising more than 60 minutes. That's when I would say, okay, yeah, maybe a sports drink is the better choice here. But I don't recommend any particular type of water. I think as long as it's straight water, bottled water, tap water, doesn't really matter.
Okay. Thank you.
Mm-hmm.
And now sports drinks, is that, I just want to bring that up because a lot of people think that they should drink a sports drink every day, a Powerade or a Gatorade. But our sports drinks, I believe they have like lots of sugar.
Right. Right. So sports drinks are designed for, I almost think of the intense athlete or the intense person who's working out. They were originally designed out of the University of Florida, which is why Gatorade is called Gatorade. And what we have learned through the different sports academies is if you're exercising intensely and you need to perform right at the 60-minute mark to 90-minute mark, if you can't replace your electrolytes quick enough, then maybe your performance goes down. But most of us are not doing that type of intense exercise. And so to say I'm going to have a sports drink to start my day or a sports drink with dinner, it's kind of like saying I'm going to have a soda. You probably don't need it. In addition, if you're diabetic, yes, they have sugars in them, which, when it comes to fluids, we really don't need sugars in our fluids. They're nice. They make it sweeter. It may help you drink more, but really the body is so used to just evolutionarily drinking water and eating our meals to keep our nutrition good that we don't have to help it anymore by loading up our drinks with extra stuff. Unfortunately, it gives sugars, more calories, and helps us put on more weight, which we really don't need to be doing.
So what you're saying is if you have diarrhea, you really don't need to use any of the sports drinks.
Now that's different. Okay. So let's say you have excessive diarrhea and you're to the point where you cannot keep food down because your tummy's hurt. Then I would say, yes, sports drink, Pedialyte probably indicated because you're not getting enough nutrition through your diet at that point. So I would say, yep, probably okay to drink sports drink or Pedialyte if you're having excessive diarrhea or even vomiting. But if you're healthy and your bowels and everything's working fine, you really don't need to be drinking or consuming any of those things.
I have a question. This is sort of it fits into the context of us being wheelchair bound. We tend to be on one side, in our chair, most or in some cases all day. Have you seen? I mean, and generally, have you seen any? I guess, this is a loaded question. I don't know how much research you've done. Is this? Have you seen any better, I guess, research going into, I guess, better materials where it's more breathable? I know it's kind of hard given that the way the base of our seats are designed.
Yeah.
Again, physics involved, and if there's too much, too much, heat in one area, it just gets crowded in.
Yeah. So and I should have prefaced this first. A lot of this lecture has to do with people who can control their own ergonomics, who may not have brain injuries or spinal cord injuries. And I'll circle back to that. But in regards to technological development for equipment, for clothing, yeah, I've seen some really cool things. I'm not personally aware of any studies going on that I can quote, but I know that cushions, for example, there are some high density foams that don't breathe well. And there are some other options like the Roho cushion that allows air to kind of pass through it. So yes, there are different options and people are considering this when they are making equipment. Now, you brought up a really good point. I know the population that I'm talking to, some people have brain injuries or spinal cord injuries. So I would put those two populations extremely at risk for heat-related illnesses and problems with regulating temperature. When the spinal cord or the brain are involved, it becomes difficult, depending on where the injury is, for your natural system to regulate itself. So much like people who have heart disease, heart disease, kidney problems, and liver problems, I would also throw in people who have brain injuries or spinal cord injuries at people who are extreme risk for heat-related illnesses and dehydration.
Brett, you mind if I interject real quick? You just said that a lot of the things that you mentioned about potential heat stroke, just me trying to run now, I have to make sure those things are taken care of because sometimes I feel dizzy, I feel short of breath.
Yep.
It's hard to get around, and I'm so hard-headed. I'm trying to figure out why I can't be like the old me.
Yeah.
Because it's hard to run a full mile sometimes because I'm running, I have many of those symptoms that you mentioned from having a brain injury.
Yep. So it is hard to kind of tease out what is my brain injury versus what is my dehydration symptoms, right?
Right.
So I think you have to trust that you know your body well and that, hey, this is different. This is not just me being my normal dizziness. This is excessive dizziness, right? And you also can't take on too much too early. Not that we don't want you to exercise, but you also have to realize that if you haven't run 4 miles and today you're going to go run 4 miles and you feel those symptoms come on, yeah, that's something to be concerned about.
Listen to your body.
Yeah, listen to your body. That's the good thing to say. So I'm not sure if there's anybody that has a spinal cord injury that's in the listening, but T8 is the level where we think that vascular control is controlled by. So people who have a lesion below T8, I think have a better chance of regulating body temperature. I think people who have an injury above T8, I'm just talking about spinal cord injury, then I get really concerned of if you go outside, do your blood vessels know how to work for you and help you sweat or help you shunt blood away or help you stay cool? So that's kind of a specific fact for spinal cord injury. Same thing for people who've had very, very, very big head injuries. Sometimes you can have some dysautonomia, where normally for people who have not had those injuries, like a brain injury, you have normal reflexes to help you stay cool, help you control your blood vessels, help you sweat. Sometimes with brain injuries, those reflexes are not normal or absent. So that's why those two populations I do get concerned about in the summer.
Yeah, Brett, for a long time, I would turn on the heat in the summertime because
Yep.
my body just could not, figure out what was going on. And I get
Yep.
cold really fast. So
Yeah.
that
Yep.
I don't
Yep.
invite people over because otherwise you have to kind of sweat.
Yes. Yes.
Yeah,
But even with different injuries, spinal cord,
I'm glad
or
you're telling us this because I didn't know.
yeah,
Thank you.
but temperature does not lie. You take your temperature, for the most part, your temperature should be a normal temperature. We think spinal cord population may have a little bit lower temperature than most people, but if your temperature is super high, no matter if you have a brain injury or spinal cord injury, that's a concern. So even though your abilities to regulate, or people who have spinal cord brain injuries, ability to regulate may be a little bit off, it doesn't mean that 103-degree fever is normal. That's still abnormal.
so would you recommend that if you feel like you have the symptoms, if you're out and about, like at an amusement park or the beach or something, and you're starting to feel these symptoms, you will get out of the sun, but do you think taking like a Powerade or something right away and then drinking water after that would kind of help, or to replenish something?
So let's, can I create an example? So let's say you're at an amusement park. Let's say you ate breakfast, you get to the amusement park before lunch, and say you didn't really have a lunch, and you're there till 3 o'clock, right? So you've had nothing from noon till 3 o'clock. If you start to have symptoms, does it make sense to drink a Powerade? It's not going to hurt you, is the answer. It's not going to hurt you. You can drink water or Powerade. Your body's smart enough, as long as your kidneys are fine, to regulate and take out kind of eventually all the salt you put into it with that salt drink, and it's going to keep the good stuff, the fluid. So it doesn't really matter. Do I think it's going to help more if it's pure dehydration? No. If you end up having really low blood sugars because you're a diabetic, yes, it will help. If your sodium is dangerously low, will it help? Yes, but if your sodium is dangerously low, you're probably so sick you probably can't drink a Powerade.